Hello, and welcome to our last presentation in the series, Managing Patient Pain During the IV Narcotic Crisis. We're going to present a high-level overview of a recent case study on how we can survive the IV narcotic shortage while keeping our patients comfortable and satisfied. IV narcotics have been the foundation of pain management for the last 40 years. Yet beginning in the summer of 2017, many IV narcotics were either unavailable or available in a small quantity, causing hospitals to scramble for alternatives. In order to formulate strategies for managing pain during this crisis, data was collected on patients' perception of pain management, the perceived efficacy of IV versus PO narcotics, the pain management ratings from patients, and RN input about daily pain management challenges and solutions. The data analysis shows that we have a plethora of alternative comfort measures that are safer and healthier for patients than the standard IV narcotic. HCA's mission statement is, above all else, we are committed to the care and improvement of human life. With that mission comes a moral and ethical responsibility to relieve the pain and suffering of every patient who walks through our doors. Every nurse, doctor, and pharmacist takes that commitment very seriously, and in the face of the IV narcotic shortage, it is imperative that we look for alternatives to pain management. Because pain is both a quantitative and a qualitative entity, both methods of research and analysis were needed to get a well-rounded view of the issues and possible solution strategies. We had two quantitative questions. First, can PO narcotics provide as much pain relief as IV narcotics? The goal was to discover if PO narcotics would be a viable alternative to IV. Second, is the current shortage already affecting our patients' rating of their pain? The goal here was to gauge the depth of our problem. If patients were already feeling their pain wasn't being managed adequately, then it would hasten our timeline for solution rollout. Our qualitative questions were, what do RNs think about the IV narcotic shortages? The best people to solve a process problem are almost always the people doing the job. It was important to get their honest feedback and, more importantly, to solicit their ideas for possible solutions. Next, is there a difference in the quality of pain management between units? This would tell us if the proposed solutions would have to be individually focused or could be rolled out uniformly. We used multiple forms of data capture, including comparing Press Ganey pain management ratings against our IV narcotic supply using correlation in a scatter plot, assessing whether our patients perceived that PO narcotics were just as effective as IV using a box and whisker plot, surveying the nursing staff for ideas on alternatives to pain medication, and comparing the mean pain management ratings between hospital units using a bar graph. Through data analysis, we were able to develop the following suggested strategies for managing our patients' pain during the IV narcotic shortage. The first is to engage providers to consider ordering PO pain relievers as the first-line defense. Next, we could educate providers and nurses about the efficacy of PO narcotics and give them scripting to guide them in their patient conversations about pain relief expectations. We could make a brochure for patients and their families concerning expectations for pain management, along with information about the opioid crisis and addiction. We also learned we should be monitoring and remediating nurses' pre- and post-pain score documentation. We also could have a TV channel with relaxing music and soothing visuals. Next, we might educate providers, nurses, patients, and their families about non-medicinal pain relief alternatives. Last, we should do further research into unit differences in staffing levels, prevalent diagnoses, and experience levels of RNs to determine how to tailor pain management education to each audience. The IV narcotic shortage is a problem for hospitals and clinics across the country. It is crucial that we develop alternative ways to manage our patients' pain so we can ease their suffering, promote faster healing times, and provide the excellent customer service our patients are expecting. Moreover, it's our moral and ethical imperative. Thank you for your time.